Hi, everyone. So today I am going to talk about bariatric surgery vitamins. So this is a lecture that I give to all of the patients that are going through the bariatric surgery process. So it's a little bit more patient focused. And then I also go over it anytime that I'm working with students. And then it's also on our website so that patients can always refer to it. Okay, so just to start off, like what is a vitamin deficiency? So, vitamin deficiency just means that there's low levels of any kind of vitamin in the body. And deficiencies are probably the number one side effect that can occur with bariatric surgery. So, my patients always ask me, like, what's the biggest risk? Honestly, one of the biggest risks of having bariatric surgery, other than the usual surgical risks like blood clots and the things that usually occur within a few days of surgery, vitamin deficiencies can occur long term. So there's a few reasons why we get vitamin deficiencies. One of them is just the decreased intake of food because the stomach is smaller in all of the surgeries. So in the sleeve, the bypass, the lap band, the stomach is actually smaller, and there's a change in your anatomy due to surgery. So that is mostly the actual major change in anatomy is from the gastric bypass and the biliopancreatic duodenal switch. But then there's also a little bit of a change in the anatomy with the gastric sleeve, but there is no change in anatomy with the lap band. So without the proper vitamin regimen, the following things can occur. You can have bone loss, which is often referred to as osteoporosis, low iron levels, which is called anemia, hair loss, alopecia, just feeling tired, permanent nerve damage, memory loss, balance issues, and then muscle loss and weakness. And then just on the right side, I just put in like a little diagram of the sites of nutrient absorption in the GI tract. So the stomach is obviously affected because in all the surgeries, the stomach is affected. And then in the gastric bypass, the duodenum is affected. And look at just the whole list of vitamins that are affected by the duodenum. So that's our main player. So with the gastric bypass, patients are at risk for all vitamins, but the main ones are going to be iron, vitamin B12, calcium, and vitamin D. So in general, we try and keep it pretty simple for our patients. So the recommendations, we start off with just three things, at least where I work, okay? The recommendations are going to be two complete multivitamins. And when we say complete multivitamins, that means that they have vitamins, minerals, and they contain iron. So you're going to take two a day daily. I usually start patients off with one a day, and then if they're able to tolerate it, then I bump them up to two a day. So that's the first thing. And things to remember about the vitamins, the multivitamin in particular, is that it cannot be a gummy. So gummies are not formulated with iron in them. So there are so many times where a patient will be like, "Guess what, Dr. Berger? I found this great gummy, and it's perfect. It's a perfect vitamin for me." And I'm like, "No, no, it's not. It's a gummy. It doesn't have everything." Or patients over 50, they'll look for a 50 plus or a silver. A lot of times you have to double check those, but 50 plus and silver vitamins don't always have iron in them because they're focused towards men and women. And as you get older, you kind of don't lose as much iron, especially in postmenopausal women who are no longer menstruating. They're not losing their iron from their menses. So that's why the over 50 and the silver formulas don't usually have as much iron in them. So that would be the first one. The second one is going to be vitamin D. And it's really based on your levels. But again, in our patient population, 5,000 units, international units, which is also 125 micrograms, that's what you need for basically anyone. So, I mean, I have patients that are up to 10,000 units a day, but 5,000 is kind of like the bare minimum. And then we've got vitamin B12. The vitamin B12, that one I always tell patients, like, it can be anywhere. You can do anywhere from 250 to 5,000 micrograms daily. You can do it by mouth. You can do a prescription injection once a month. You can do a nasal spray, whatever is preferred. And with the vitamin B12, the main thing is it's very easily absorbed, but it can become low very easily as well. So you have to be taking more than what's already in the multivitamin. Multivitamins have a really low amount of vitamin B12. So 250 to 5,000. I usually will recommend more like 5,000 in patients that have a history of low vitamin B12. Sometimes we have to work up why do they have a low vitamin B12, but if they just have like a borderline low, then I'll have them do 5,000 a day. And the main thing with that also, and I don't think this is mentioned in the slides, but for the first 6 months, and I have a whole video on thiamine deficiency and Wernicke's encephalopathy, which can occur in the first 6 months after surgery. That one's due to thiamine, which is another B vitamin. So in patients in their first 6 months after surgery, they can do the B12 every day, or they can do a B complex, and the B complex has all the vitamins in it. And then there's calcium, 1,200 to 1,500 milligrams a day. And that needs to be split up in order to be absorbed properly. And it also needs to be separated from the multivitamin because iron and calcium interfere with each other for absorption. So what I usually recommend doing is telling a patient take one multi, D, and B12 all at the same time. Then if you can, take your second multivitamin. And then later on in the day, you'll at least take one calcium and try and fit in the calciums when you can. In most cases, if the patient is getting enough calcium in their diet, they just need like one of the doses of the calcium, and then enough is in the multivitamin and in their foods. If they're lactose intolerant, we need to be a little bit more mindful of the calcium. Calcium can come in calcium citrate or calcium carbonate. Calcium carbonate is better known as like Tums or antacids. Those need to be taken with food, but calcium citrate can be taken at any time of day. So, and again, any time of day, meaning with or without food, but you still can't take it with your multivitamin. So the calcium carbonate is really easy. I tell patients, just take it like whenever you eat, and then that's an easy way. And they prefer to do the Tums as well. Oh, and another thing to mention about the vitamins is that the multivitamin is the biggest vitamin there, on that list. The vitamin D is extremely small. The B12 can be in any form. Usually patients will choose like a sublingual, meaning that it dissolves under the tongue. So none of these vitamins take up a lot of room in that new, smaller stomach. And that's something you really have to bring up to patients because sometimes patients will have this new, really small stomach and they can't be taking a ton of supplements, especially if they're on lots of other prescription medications. So we have to focus on just those three, the multi, the B12, and the D. I repeat that so many times, it's crazy. Multi, B12, and D. That's what you need to focus on before you're getting in your ashwagandha and like all these other vitamins. Those are the main ones. And then again, the calcium is pretty easy because usually it's chewable. If patients have problems tolerating the size of the multivitamin, again, they can't do the gummies, but they can do a chewable. They can do 2 adult chewables, or they can do 4 to 8 children's chewable, depending on the dosage. So they can do that. Let's see. And those are main things I wanted to bring up with that. And then we have the gastric sleeve. The recommendations are the same for the sleeve. So the stomach is removed, and that part of the stomach that is removed secretes acid. Acid is needed for vitamin absorption, almost all vitamin absorption. So again, that's why you need it for both the bypass and the sleeve. And then I'm not going to get into this one because it's kind of complicated, but the biliopancreatic diversion with duodenal switch, this is the most malabsorptive of all the procedures. Recommendations are the same, except you have to be more strict about the 2 multivitamins daily. The vitamin D is usually up to like 10,000 units a day. And then I usually recommend 5,000 of the B12 to start off with, and then a vitamin A, D, E, and K supplement. And the vitamin A, D, E, and K, those are the fat-soluble vitamins, and those are necessary when you have the duodenal switch because there's more fat malabsorption. Revisional surgeries, again, not going to get into these just, for the scope of this lecture or this video. But the main thing to remember with this is that the vitamin regimen in most cases is the same as your primary procedure. So, and you always pick the more malabsorptive of the procedures. So like if someone had gastric bypass and, or if they had like the sleeve and then they're going to get the duodenal switch, then obviously you're going to do the duodenal switch vitamin regimen. Okay. And again, just stating these same and the things to remember with this is with vitamins is that you don't have to spend a lot of money on vitamins. I have patients that are like, well, I'm going to go to GNC and get this and that. All you have to do is just get like the brand name vitamin at any store. So like if patients go to Costco or Sam's, they can get the Kirkland brand. They can get the Target brand. Walmart has great vitamins. Anything on Amazon, I like Amazon also, or actually any of the online retailers because a lot of them have subscriptions. So the patient will never run out of their vitamins. And I do, as much as possible, I do actually encourage that they buy their vitamins online because a lot of times you'll go to the store and they don't have everything that you need. The stock is not as great as it is online. And again, like I was talking about the multivitamin recommendations, even a prenatal is really great. I even recommend prenatal for my male patients, and they freak out. They think that they're going to develop breasts or they're going to become pregnant. And, I always reassure them that those things won't happen. Really, the only difference between a prenatal and a regular vitamin is that the prenatal has a little bit more iron and folate in it. But a prenatal is actually a really great, like, bariatric multivitamin. And as I had said, the multivitamins either need to be in pill or chewable form. Gummies do not have iron in them, and you can't take senior or silver formulas. And then for the B12, very easy, just need to take it. The B12 can become low and cause all sorts of nerve issues, but just taking it once a day is great. And then just on that note, a lot of times when we check the blood work, so blood work has to be checked on a schedule after surgery for life. A lot of times the B12 is extremely high. There's no harm in having too high of a B12 level. Okay. So B12 can be high when you check the labs. There's no harm in that. If a patient likes taking their 5,000 every day, it makes them feel good, that's fine. If they want to save money, then they can do maybe 5,000 every other day. I always just tell them, do not stop taking your B12. As long as you're taking it, 1 to 2 times minimum a week, then, and your absorption is okay, then that's fine. Okay. And then finally, the vitamin D. Vitamin D varies, but this one needs to be monitored. This is a fat soluble vitamin. So taking too much vitamin D is actually harmful. So in that one, we don't want them to take too much. The usual dose is going to be 5,000 units daily, but sometimes patients do need a little bit more. And I still haven't figured out which patients need more. Darker skin tones, a lot of times, and higher BMIs will need more because they don't absorb as much from the sun. And when you have a higher BMI, more of the vitamin D is sequestered in the fat. So as they lose weight, the vitamin D actually becomes more bioavailable. But then I have some really light colored patients that require a lot of vitamin D. And sometimes I'm even like, I don't believe you. Are you taking your vitamin D? And they're like, yes, I'm taking the 5,000 every day. So then we just have to increase it to 10,000. So hopefully I'll figure out the correlation with that and get back to you. But right now it's just like you have to check the blood work and go from there. And then the calcium, I got into this before. Again, I kind of focus on the calcium after they've mastered their their B12 and their D. And then vitamin B1, thiamine. So I do have a video posted on the vitamin B1, the thiamine. So please refer to that. It's a whole video on this and I'm going to, bring it up for just a few minutes right now. It's incredibly important to be taking a multivitamin to prevent vitamin B1 deficiency, thiamine. Okay, enough is in your multivitamin, but low levels can occur anytime after surgery. It could be 2 days after surgery. It could be 6 years after surgery. Most patients are more at risk for low levels about, the first 6 months because that's when there's more intolerances from the surgery. There's more swelling. There can be nausea, vomiting, and then intolerance in taking vitamins and intolerance in taking any kind of food or drink. So thiamine needs to be first on the list. If I always tell patients, you need to be aware of this. If you are not able to take anything by mouth, still try and take your B vitamin. Okay. And signs of low B1 can be confusion, weakness, memory loss, unsteady gait, which is also called ataxia, vision changes, nystagmus, and that can be permanent. So it's really scary because a B vitamin is so easy to take. There's no harm in taking too much, but if you don't take it and you become deficient in it, and this scenario occurs, these things can be permanent and even coma and death. Okay, so on that note, I am going to end this video, and I will link the thiamine video above, as well as a few other vitamin videos that I have posted. And again, thank you so much for watching. Let me know if you have any questions. And as always, share this with anyone that would benefit. Like and subscribe, and let me know what would you like to see next. And please take your vitamins. Thanks.